Hello, everyone, and welcome. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two, and author of A Life, a Finger, a Pee Up a Nose, and I'm lucky enough to be founder of CPR Kids as well. And I'm joined today by holistic paediatrician Dr. Deb Levy, who I have had the pleasure of working with in the hospital setting here in Sydney as well. And also, I am really excited that Deb gets to share her knowledge with all of you today as we talk about welcoming your little one. So what to expect in those first few weeks with your little one. So what is normal? Because certainly when I brought my first one home, even though I am a paediatric nurse, I had no idea what I was doing. And so, yes, knowing that little bit can help you enjoy it that little bit more as well. So what I would love you to do before we get into this, I'm going to get Deb to give you her introduction properly, is that while we're here, can you just give me a thumbs up or a wave or comment down below just so we know that all the technology is working as we should. And remember, if you can't tune in live for the whole session today, we will be posting this to the Baby to Toddler Show, Deb's group, and also the CPR Kids pages for you to watch afterwards. So Deb, tell everyone who doesn't know you a little bit about yourself.
Great. Thanks so much, Sarah, and it's always wonderful to chat with you. So as Sarah already mentioned, I'm a holistic pediatrician and also a mum to two girls. Mine are a little bit younger. They're 4 and 6. And what's a holistic pediatrician, you may ask? Well, essentially, I'm a conventionally trained pediatrician, but I have a special interest in seeing the child as a whole. And by that, I mean also incorporating nutrition, lifestyle, as well as exercise and relaxation techniques into looking after children. I usually practice in Sydney, in Bondi Junction, but I'm actually currently in Canada, which is why I'm wearing this jumper. It's -8 degrees here.
Oh, it's not that warm here either, don't worry.
Okay. While I'm here, I've decided to really focus on, a bit of a side passion of mine, which is really educating parents and empowering parents, giving you guys the tools so that you can better care for your kids.
Fantastic. And the good thing is that we are bringing you a 4-week series. So if you like what you hear today, please come and join us same time, same day over the next 4 weeks. So let's get into this. Now, I'm just going to share our screen just here. There we go. Hang on. There we go. So, Deb, you're going to have to tell me when you want me to drive this.
Good teamwork here, Sarah. And I'm just going to apologize ahead. I seem to have a bit of something caught in my throat, so I may keep on coughing. So it's not COVID, even though we're in lockdown here. But anyway, so the first of, as Sarah mentioned, a series of 4 on newborn babies is Welcome Little One. And really, this is just walking you through what to expect in the first couple of days to the first few weeks. It's the kind of stuff that I really think will help you as new parents, and a lot of it that I wish that I'd known, because even though I was a doctor mum, a lot of the normal stuff you don't really know until you're experiencing it. So
exactly.
Let's get going.
Okay. Now, there we go. Oh, no. There we go. Okay, I will, but you watch. By the end of this, I'll have it perfected.
Okay, so what are we going to be chatting about? I'm briefly going to mention the process of the delivery from a pediatrician's perspective, and then touch on feeding, sleep, and growth, which I think are the 3 most important, and then at the end, a couple of other topics if we have time. And just to mention, I'm very, very happy to answer questions. Obviously, I can't give specific medical advice, but feel free to ask, and we'll allow some time at the end for that.
Fantastic. Very good. So make sure that you get your questions ready, everyone, and type them into the comments below.
Yeah. Okay. So essentially, the delivery is up to you and your midwife, doula, obstetrician, and, as a pediatrician, we don't really take any part of that. The only things that I want to mention from the baby's perspective are around delayed cord clamping, skin to skin, and seeding. So you may already be aware of what this is, but delayed cord clamping is essentially delaying clamping of the umbilical cord for 1 to 3 minutes after delivery. And the thought then is that more of the blood from the placenta can go to your baby, which then decreases the risk of anemia, as well as increasing their iron stores, which is such an important micronutrient for growing children. Yep. This is obviously only if the baby is healthy enough to have this. Mm-hmm. The side effect is that does make them slightly more at risk of jaundice. And if you want to know more about jaundice, I actually put a quite a good post on my Instagram today, which outlines jaundice for you. Skin to skin is such a powerful and beautiful experience. Even if you have to have a cesarean section, it's definitely possible, again, depending on the safety and health aspect in terms of how well your child is when they're born. Seeding is an interesting one, and Sarah knows, and anyone else who's listened to any of my talks, that I am slightly fanatical about the microbiome, and this is one proposed idea in terms of helping Caesar babies to improve their microbiome, so their gut microbiome. I'm not going to go into all the details of this, other than to say, seeding it's called vaginal seeding. It's a swab that's placed in the mum's vagina prior to a cesarean section, and then that's removed and it's wiped externally on the baby in order to try and almost simulate the experience of being birthed through, through the normal canal in terms of exposures to different microbiomes, the probiotics that are sitting there. That depends on whether or not your obstetrician is happy to do that, and obviously whether you have any infections, etc. But I'm not going to get too technical. I just wanted you to be aware it exists and to have that discussion with your doctor. So now then I guess it's, when do pediatricians get involved? And usually we get involved, when things are kind of going wrong, or when they anticipate that there could be problems. Mm-hmm. So hopefully you don't see us at delivery is really what I'm saying.
Yeah, it's actually a good thing. Yeah.
Yeah. So the APGAR score, I think a lot of parents aren't very comfortable with what it is. And I thought, I would just explain that, because what it is, it's a screening score that's done at your baby's birth. And it's done at 1 minute of life and then at 5 minutes of life. And really what it does is it gives an assessment of how your child has managed and has coped with the delivery process. They look at 5 parameters, color, reflexes, breathing, heart rate, and the muscle tone of your baby. Anything above 7 is normal. It's very unusual to get 10 out of 10, 10 being the maximum, obviously, because it's very common for babies' hands and feet to remain that bluish, purplish color. Even after for the whole first day of life.
Yep.
Okay.
I had one completely purple baby, but yes.
Yeah. And if the APGARs are low, what does that mean? It means that your baby needs some more support, and that may mean some oxygen or stimulation, or maybe they need to go to the special care nursery. So just so you know what that number is.
Mm-hmm. Okay. Absolutely. And I think it's really important to remember that often we can go in thinking of what we would like to happen. Often it doesn't go that way. At the end of the day, whatever is best for you and what is best for your baby is what needs to be there. And if you have had a trauma with, a birth trauma, it's really, really important that you do talk about this. And there are lots and lots and lots of resources out there for you and support groups. So please, I encourage you to go and talk about this. It's really important. Okay.
Yes.
Yeah. All right. There we go.
I just wanted to mention that I've created a great free resource for you that you're welcome to go and download. There's the link, and I'll give it to you again later. And what that is it encompasses quite a lot of what I'm going to be covering over the next few weeks. And I think it's just really all my top tips for you guys in one spot. So there it is.
So that will be very handy indeed.
Yeah, if you forget the download, you can also find that on my Instagram. So that's another easy way to find it in my bio on my Instagram.
Excellent. Okay.
Okay, the big one, feeding. Okay, so the whole choice of breast versus bottle or formula feeding, I'm not going to discuss, because I think ultimately, breast is best, and I can talk for an hour on the benefits of breast milk. I'm not disputing that, but I think that it can be a very challenging time for mums, and I think we do need to be sensitive around this. And to me, it's never about judgment, and it's always about having the discussion with a mum in terms of what she wants and what's going to work for them as a unit, them being mum and baby, and the extended family, but ultimately that mother-baby unit, and then supporting mum with that.
Yep, absolutely. So that's important. Very important. We want to put that out there, that there is no judgment. Really important.
100%, yeah. And so whatever you may choose, I think it's a good idea to be comfortable with what you're going to do before day dot, and then prepare yourself for that, whether it's buying the bottles, buying a breast pump, getting the bras, whatever it may be, just get yourself ready for it.
Yeah.
I think the first feed is a very magical moment for babies, especially if you are breastfeeding, because it's quite a fascinating thing, especially if you're doing a skin to skin, because babies can actually crawl. And this is like within, 20 minutes after birth, can crawl up and latch on, which I just find quite fascinating as an aside. But the first feed is very important, both to help establish let down if you are breastfeeding, as well as initiating that bonding process, which doesn't always go that smoothly, but just we need to be aware of it in order to best support it, I believe. I'll put sugars down as something to talk about, again, because I think that parents need to be aware that they should be monitored. And if you wonder why your baby is suddenly having their heel pricked and squeezed, that is why. The heel is pricked in order to get a small spot of blood, and that blood is tested for a sugar level. The worry is that if your baby's sugar is too low, then they may need something to bounce their sugar up. I just have to have a sip. Sorry, I told you I had a croaky throat.
No problem at all, Deb. No problem at all.
You're right. So what if your sugar's low? As I mentioned, it's what we want to do is get that sugar up, because it's actually quite dangerous for a baby to have a low sugar. Depending on how low it is, if it's exceptionally low, your baby may actually need to have a drip put in and to be given sugar that way. But usually it's just a little bit low, in which case a feed is what's required. And sometimes that may mean a little bit of formula, even if you are breastfeeding, just to pop that sugar back up to a safe zone. And what are the dangers of low sugars? Really, it can cause seizures and problems with the brain. So very, very important.
And I think it's important to remember that this isn't something that particularly you need to be actively worrying about if your child is starting to look and become unwell. If you come into the emergency department and you've got a little newborn with you, one of the first things we'll do is test their blood sugar. So this is something you need to be worrying about at home. This is something that we would take care of in the hospital. So important.
So now what to expect in terms of feeding? Okay. I think it's important to be aware of a couple of things. One, when babies are born, their tummies are really, really teeny tiny. On the first day, it's probably, about can you see about that big, tiny, 5 mils. So they're not going to be able to cope with a large volume. And this might mean if you've got a generous supplier, they're having a formula feed, that they might vomit that up. That can be quite common over the first few days as their stomach grows and gets a bit more accustomed to feeds. Obviously, though, if your baby is having large vomits, vomiting persistently, then that's something different. But I'm just talking about these small little posits or spit ups that a baby may have. The other thing to note that could be normal is a baby vomiting up some fresh blood. And the most common cause of this is that they've actually swallowed fluids during the delivery process.
Okay.
And as you know, that fluid is really quite yucky, and it's often got a bit of mucus in it, a bit of froth, and and it sits in their tummies, and that makes them feel a bit nauseous, and then they vomit it up. And it looks really scary, but definitely get it looked at, but it's nothing to worry about.
Excellent.
The issue around frequency of feeds and demand versus schedule. At this stage of the day, I believe that you should feed on demand. And again, there are lots of schools of thought in this, but I don't think that when babies are this young, you can do anything other than feed on demand, bearing in mind you should not let it go beyond a few hours. So the general recommended interval between feeds for the first few weeks is 2 to 4 hours in between feeds. And that's from the beginning of a feed to the beginning of the next feed.
Yeah.
And that includes waking overnight for the first little while, especially if they're not gaining weight, etc.
Mm-hmm. And I think one of the important things to remember as well is that ask for help. Breastfeeding, certainly, especially with my first one, was not easy. It was not easy. It did not come naturally for me. I chose to persevere, and I had help. So I had lactation consultants and so on who really helped me through that journey. It is not something that I could have done on my own. So if we are lucky to be here in Australia in a place where there is a lot of information around this, and you can go to your maternal and child health nurse and have a talk with them about this. So don't just think that you're by yourself in this. You're not. There is help available.
Yeah, and I think one of the hardest things, especially if you are breastfeeding, is knowing if your baby's getting enough or not getting enough. As you know, you can't measure it. And especially if you've got a baby who's a little bit unsettled, which again is quite almost like normal behavior really for the first little while. And definitely a lactation consultant is worth their weight in gold, or an experienced nurse, or, even your mum, or, your auntie, or someone who's had a few children can help.
Yep, absolutely. So I think the important message there is don't do it on your own.
No.
Exactly.
Okay. This also leads on from feeding, because one of the big ways to determine if your child is feeding well is by monitoring their weight. One thing to note, of course, is that all babies will lose weight after delivery, and that's up to 7 to 10% of their birth weight. It's entirely normal for them to lose that. However, they should be gaining weight again by about day 4 or 5, so it should start to pick up again, and then they should be back at their birth weight by 2 weeks old. Mm-hmm. And at that point, they're then gaining about 120 to 200 grams per week. Bear in mind, this is an average. Every child is different. It's different for breastfed versus bottle fed. The bottom line is they should be tracking along the percentile chart, and I've put a little growth chart there just to remind you what it is. And if in doubt, definitely follow up with your healthcare practitioner, because growth is really one of those important parameters we always monitor as an indicator of well-being as well as nutrition. So I think that those are some really good figures for parents to keep in mind. And I guess the other thing that I didn't mention, sorry, just with feeding as well, is the number of wet nappies. But we'll talk about that I think it's next week when I'm going to talk all about nappies. So we won't go into that now.
Mm-hmm. Fantastic. And I think the other thing to remember as well is that when you're looking at trends on this growth chart, that it's not where initially that they are placed, it is just what is the trend that they are doing. Because I know that my child, my youngest one, she was on the 10th centile, but she kept in, so that means that, she was on the lower side, she was tiny, she still is tiny, that's just her. But it was her trend. She was increasing weight. She was growing. She's doing all of those things, but she's just significantly smaller than a lot of her peers. And so that's why we need to remember that it's where they appear on there. It's not good. It's not bad. It just is, but it's what's happening over time that I think is really important as well. And has it changed?
Well, that's exactly what I was going to say. We talk, the medical kind of lingo is, whether they've crossed percentiles. And what we mean by that is that they've changed from one percentile down to another, if not down to another, so it's crossing over the lines in the graph that you can see there. And that is very concerning. there's a small caveat in that genes also play a role. So it's thought that with young babies, and I'm digressing a little bit from the newborn, but with young babies, their birth weight is more reflective of mum and the pregnancy, whereas they shift at around about that 4 to 6 month age to their genetic potential. So sometimes I'll see growth charts like that, where they shifts at around about that age. But that's under a watchful eye and excluding anything else. But as you said, most importantly, it's about the trend, and it's about children showing us that they are growing the way that they're meant to be.
Yeah, exactly. I love that. The way that they're meant to be. I love it. That's exactly right.
Okay. Sleep. This is all what we expect and hope for when we have our first child, but we don't get it, except for the first few days. The classic pattern within the first few weeks is that when your baby's born, that first day, they're usually so zonked and exhausted from the whole process that they sleep really, really well. And you think, oh my goodness, I've lucked out here. I've got like the world's best baby. And then they start waking up, and then they start frenzy feeding at around about day 3, where they just want to feed all the time. They're not sleeping. Then over the next few days, they start thinking that the day is actually the night and the night is the day. And they eventually start establishing more sleep patterns. But absolutely, the first few days, they sleep more. And that's when I said sometimes you'll have to wake them depending on the advice given to you. And then they start to do their 45-minute sleep cycle. They usually sleep for about 45 minutes to begin with in terms of a sleep cycle. And then that'll stretch to like 1 to 3 hours, you hope. And then by around about, and this is so variable, even between my 2 children, they were so different. But usually they start to sleep better, that 3 to 6 month mark. And this is a generalization here. The other thing I want to just mention with sleep and behavior is, again, I'll find the first 2 weeks are often like a bit of a honeymoon period for babies, and they're really chilled, going with the flow. But then from around about 2 weeks, they'll often something switches and they wake up a little bit more, and that's often when they become a bit more unsettled. And then you start querying about, do they have colic often, or do they have wind, or so I'm just trying to give you an overall picture of what to expect and what's possible within the realms. But with sleep, when they're very little, especially for the first weeks to the first couple of months, you cannot spoil them. Cuddle them as much as you want. You cannot sleep train them. But also start to learn what their tired signs are. I always describe the 4th trimester, and I'll talk about that a little bit more if we have time, as a period of nurturing as well as getting to know each other. And that's as a mum, getting to know your baby and how they communicate with you, and baby getting to know their environment and the world and living in a totally foreign place. Yeah. And it's a period of great adjustment. With the tired signs, there are a classic few, and if we have time, I can go into those today. But we can always touch on them in the questions. I think that's probably better, just bearing in mind how long I've been talking for.
No, we can do that. That's easy. So remember, start typing your questions in, and we will come to them afterwards as well. Excellent. So development. Ooh, okay. This is a fun one.
Yeah, I thought this is a cute picture. So little babies don't do much. I'll be quite honest with you. And, so you can't expect this. You can't expect the wide eyes, the smiles. And the one thing the reason I chose this was the hand as well. And I'll go through that now with the different elements of development. So first of all, the senses, yes, babies can hear, and everything actually sounds pretty loud. It's no longer muffled by the amniotic fluid of being in your belly, which is why they're often startled to loud noise, which is why as parents, we all tippy-toe out the room, stealth mode when they're falling asleep. Right. Vision, babies are born with blurry vision, and I think it's such a sweet thing that what they've shown is babies are able to see the clearest at around about 24 centimeters, which is almost the same distance as if baby's in the crook of your arm to mum's face, which I just think is such a beautiful thing. But anyway, yeah, their vision will slowly improve. Okay, they will prefer contrasting colors in terms of black and white, bright and dark, as well as faces. Gross motor, their heads need supporting. They don't have much central strength yet, but tummy time started now, because if you don't initiate it early, it becomes harder and harder just because it's not part of your routine. Fine motor, they keep their hands clenched, which is why I chose this photo, because the hand isn't clenched, and usually they're holding their hand open only by around about 6 weeks. So it's very common, and you've got to kind of open them up to clean them, and they get little lint and bits of dirt in them. Communication, their only form is crying. So crying doesn't necessarily mean they're hungry. It doesn't necessarily, mean that they're in pain. It's their only way of communicating with you. And it can be very tough as a new parent to try and work out what your baby is telling you. Yeah. And it's about learning. And, I've heard a lot of babies cry. I know it sounds funny, but in my work, and I'm sure Sarah, knows what I mean when I say you'll learn and you'll kind of get it. You won't get it right all the time, but you'll kind of go, oh, that actually means that they're hungry, or that they're upset, or whatever it is. So, that's what it is. Bearing in mind, of course, that babies don't actually develop tears for their first few weeks. So that's a tearless cry that they'll be doing to start off with.
Yeah. Okay. Sometimes it's just a process of elimination, and I certainly what Deb has said. You do know that eventually you do know. I know the difference between the difference between that cry when they're hurt, when they're in pain. The pitch of it would be so different in comparison to if they were just cranky, or they needed something else. And you do get to know that eventually, but don't expect yourself to know that straight up. It will not happen. Exactly. There we go. Oh,
yeah, I know. So I've kind of put a whole lot of stuff on this last topic, because there is so much more we could talk about, and I guess I decided to put these topics down just so that the audience could decide what they wanted me to mention or to go a little bit more into. And obviously I put safety down because of your expertise, Sarah, and I knew that you could share some of your wisdom when it comes to sleeping and car seats, etc. Have we had any questions come through yet? Or
no, we haven't as yet. If anybody would like to ask a question, please just pop them in.
Otherwise, we'll decide what we talk about.
Yep.
Yeah. But I've already mentioned the 4th trimester, and I just wanted to chat a little bit around attachment parenting. Basically just to say, well, what is it and what are the possible benefits? Attachment parenting is essentially responsive parenting, where you have your child with you at most times. So that's baby wearing, co-sleeping, and on-demand feeding. There are a lot of fans of it. There are a lot of people who don't want to do it. Again, one of the questions I will always ask my families is, what is it that you want? How do you envisage this journey? And then, you work to support families around that. There is no right or wrong way when you love your child and you're doing, the best by them. So the first 1,000 days, that is a massive topic in itself. I just wanted to touch on it today in terms of how I approach children's health and well-being, in terms of having a holistic approach. And what the first 1,000 days refers to is actually the impact that we have on our children's long-term health and development from the time that they conceive to their 2nd birthday, and what nutrition they have, and what social supports, as well as what environmental exposures. So it's a whole world that we can tap into to give our children, I'm not going to say, the best opportunities, but I certainly think that we can nudge things in the right direction. And that's a lot of what I work with when it comes to looking after children and young children especially.
Mm-hmm. Oh, absolutely.
What should we go on to next, Sarah? Let's I think safety is probably a huge topic in itself.
It is absolutely huge. And I think that's, we do have a lot of stuff at CPR Kids about those certain things. But I think when you're thinking about coming home, really have a look at the safe sleep guidelines from Red Nose. I think that is incredibly important that you really do know about those. And of course, car seat safety, I think we're really aware of, your child needs to be in something that is rear facing. I won't go too much into that, but the one thing that I really do encourage you to do, just because we see it so often, is that when you are changing your baby on a change table, if it is up high, you always keep one hand on, and always use the straps if they're in the pram, if they're, whatever you're using, even though you think they're so little and they can't go anywhere. If there are straps provided, use them.
Oh my goodness! I cannot tell you the number of babies that when I was working as an emergency consultant in one of the children in the children's hospitals, how many babies would come in with head injuries, not significant ones necessarily, but just injuries, and very worried parents. And the story was always, they fell off the change table, the change mat, and they'd never rolled before. That was their first time that they did it, and they did it when they were up. And thankfully, none of the cases that I looked after had any significant injuries. But absolutely is a great point, Sarah.
Okay, excellent. Now, notice that we have come up to 30 minutes here. Is there anything else that I need to click through here on the presentation, Deb, or is that all done?
Look, I just outlined the holistic approach just so that parents were aware of it, but we can talk about that another time. And then I just reminded people how to get that resource that I've created, which was the next slide, and you're welcome to leave that up in case.
Excellent. But I think it's really important that we do arm ourselves with really good information. And so, Deb, thank you very, very much for actually putting this together, because one of the things are that we don't want you to be afraid to ask for help. You don't need to do this on your own. We encourage you not to do it on your own. There are lots of good experts out there, Deb being one of them, and that we really do need to be supportive of each other in this. And this is why we do what we do. It's why we're broadcasting out to you today, so that you do have that information. Now, there haven't been any questions today, which to me says that you must have covered things very, very thoroughly, Deb, which is a good thing. Either that or the question function isn't working properly. I think it's that you probably have covered everything really, really beautifully, which is a very, very good thing. So what are we going to be talking about next week, Deb?
I think it is the one on, I'm just going to pull up my list here, but I think the one is on.
I'm just putting you on the spot. I'm sorry about that.
I just don't know the order of them. I can tell you the 4 that we're talking about, but I think next week's is poos and peas and everything in the nappies. And what I'll be talking about is bowel movements, obviously, what to expect in nappies, girl bits, boy bits. And then the following talk is on reflux and the unsettled baby, which, I think that a lot of parents will hopefully have a lot of great information from that. And then the last one is almost like a top to toe, and I've called it the weird and wonderful of newborns. Fantastic. And really what I go through is what to expect from the newborn baby exam, which your baby should have. But also to go through things, and I talk about funny shaped heads, I talk about eyes, jaundice, tummies, like hernias, like a whole multitude of things. And again, pointing out what's normal, what's not, when do you worry, when do you need to go and see your healthcare provider urgently, again, guiding parents so that, they enjoy the process more, because being a parent can be tough. It can be stressful. And I think that the more you know, the easier it is.
That is absolutely true. Yep, and the ability to go and get support. So thank you very much, everyone, for joining us today. We will be posting this to our pages afterwards as well, so that you can refer back at any time. And we are looking forward to seeing you again next week, same place, same time, and same day. And we hope you have a fantastic week. And don't forget to share this around with everybody who you think will benefit from this good evidence-based information. Okay, thank you so much, Deb, for joining us.
Thanks,
we'll see you next
everyone.
week.
Thanks. Bye.
Okay, bye-bye.